It's time now for Countywide, a special presentation of Yavapai Broadcasting News. Join Paul David and Kyle Benedict as they talk with our community's leaders, newsmakers, and people in the know. You'll hear about the hot topics that affect all our lives in Yavapai County. And now here's today's Countywide.
Welcome to Countywide. I'm Paul David. Once again, great to have you in studio with us today. Byron Lewis of North Country Healthcare is in studio with us today. We're going to be talking about Affordable Care Act, which is going to be very important to folks in the coming months.
Yeah, had a big impact.
Welcome to studio. You had quite a drive over from Snowflake this morning.
Yeah, it was kind of nice and quiet, dark, able to think a little bit.
I know how that feeling is coming to work and it's always dark out. So let's find out who Byron Lewis is first. How about we start there?
Okay, I work for North Country Healthcare as a navigator, and I'm a native Arizonan, 6th generation. If you ever drive through Holbrook, Arizona, and you see those wigwam hotels, the teepees, my dad and granddad family built that.
Okay.
So we've been here a long time. I have a vested interest in Arizona. We raised our family here. They live here in the area. It's a great place to be. I wouldn't want to be anywhere else.
And you were telling me before we started that your territory is extremely large. Your coverage, like your trip today, you've come here now for a 3-hour drive. You still have Flagstaff to go today, and
then I'll be back down in Snowflake and Show Low for some city council meetings. Yeah, my territory, as far as a navigator goes, is the largest one in the country, bigger than some European nations, actually. There's 3,007 counties in the United States, and 11 of them that are in the top 10 are all in Arizona. Coconino's number 2, Mojave's number 5, Apache's number 6, and Navajo County, where I'm at, comes in at number 11. What else is very interesting in those counties, as well as being the largest geographical, 2 of them are in the top 100 poorest counties in America. Navajo County comes in at number 85, and then Apache County, depends on the day, is in the top 10, usually around number 7. And the company that I work for has a presence in each of these areas. We do in Yavapai County as well, in Ash Fork and Seligman. And what we do with our outreach is we're letting some folks know what some of their options are under the Affordable Care Act right now, and when their open enrollment dates are, when it ends, some penalties, those kind of things.
Okay. What's a navigator?
You know, some days I wonder about that myself.
Okay.
Navigator is somebody who's familiar with the system, knows the law, and is able to help folks understand what their options are. Let me just do something to kind of depoliticize this, because believe me, I get it. I've talked to over 250,000 people. I've traveled almost 70,000 miles in the last couple of years. I've put on probably 250 presentations. And a lot of folks want to know what it is up with the Affordable Care Act. It's basically this: 2010, Congress passed it, Senate and House. They were democratically loaded, there's no doubt, but they sent it to President Obama, who signed it. And it was enacted into law. Then the Supreme Court heard a case where it was challenged, and they upheld it. And then again, 5 years later, just this last year, it was upheld again in a controversial, very close decision. And there's another court case out there right now that's pending before the Supreme Court to challenge it. My position on this is it's a health care issue, not a political one. And I feel that my role is to let you know what your options are under the law. If you like the Affordable Care Act, great, sustain it. If you don't like it, then do what President Obama suggested and vote for change. But between now and whatever outcome's out there, isn't it in your best interest and your family's best interest to know what your options are under the law? Because if you don't have insurance this year, you're going to be paying a penalty, and that comes right out of your taxes.
Is this the first year with the penalty?
Nope, this is year 3 with the penalty, but the penalty's been accelerated. Started off as $95 in 2 years ago, then to $395 last year, and this year it's $695 per person minimum. Let me just get the penalty out of the way. If you're a family of 3, for example, 2 adults and 1 child, if you do not have health insurance this year, the minimum penalty that you'll be paying is $1,738.50.
Okay.
And that comes right out of your taxes. And you know, people like in Apache County or Navajo, where they're among the poorest in the country, and folks here in Yavapai County, that's a chunk right off your taxes.
That's a big chunk.
That's school clothes, that's vacation, that's car payments, rent payments for the mortgage, for a big chunk of the year for folks. And so one of the things I look at my role as doing is to let them know when the open enrollments begin and end, if they miss those, what might qualify as a special enrollment period, so that again, they can make the best decisions for them and their family.
Now, how is this taken? You said it's taken out with your taxes.
Yep.
How's it taken? So we don't. How do we see that happening?
When you go in to file your taxes, typically with your accountant or H&R Block or whoever, they're going to ask you if you have health insurance. And if you say no, the penalty is automatically calculated. Now again, that's what the minimum penalty is. It's $6.95 per person for an adult, half that for a kid. Or, there's always an or, isn't there?
Mm-hmm, yeah.
2.5% of your adjusted gross income, or your MAGI, whichever is greater.
Oh, okay. Yeah. So it could be much more than that.
It could be. It could be.
Okay. So what do we have to do to avoid this penalty?
You have to have insurance. You have to be covered. Now, if you're already covered under something like TRICARE or VA, or you have work insurance through your work, or you're on Access, you're covered. You're okay. You'll be able to avoid the penalty. If you go out on the marketplace, and there's a lot of plans out there, kick the tires, see what's out there, sign up for one of those, you're going to be covered as well.
What's the best way of doing that, though?
Healthcare.gov.
Okay.
Healthcare.gov is a good site to go to. It's the marketplace site, and it's really gotten a lot easier than year one, when that website honestly was a disaster. Mm-hmm. It was tough. Last year they had a couple of bumps. I've been on it this year several times, and it's pretty smooth sailing. They're going to ask you basically 4 questions. They're going to want to know where you live, demographics, how old you are, how much you make, and whether or not you use tobacco. No one ever gets that. They'll ask you your gender, but that won't factor into your insurance costs. In fact, men and women, it's a pretty level playing field. They're not going to penalize one gender or the other. It's pretty level in the marketplace. Tobacco use is defined as 4 weeks or less, 4 times a week, or less. And here's something interesting. E-cigarettes don't qualify as tobacco use.
Okay.
So for some folks, that's a big plus. And the reason why is tobacco use can impact your premiums to perhaps 5% more, or 5 times more than what you would be paying without being a tobacco user.
Okay.
I think it's important to let folks know when the open enrollment begins and when it ends. The statistics out there are pretty clear. 90% of Americans don't know either of those dates. Open enrollment begins November 1, and it ends January 31st. And during that time, you can go in the marketplace, you can shop, you can kick the tires, you can compare plans, apples to apples. See
so, okay, let me jump in. So if I've had a plan now for the last year, this next period that's coming up, November 1st through January 31st, this is my opportunity to say, okay, I don't like the plan I have right now.
That is really a good way to say it.
Is that it? So if I've been unsatisfied with what I've had over the last year, now's my chance to say, okay, goodbye, old plan. I'm going to shop through this period of time.
Exactly.
Right through the holidays.
Exactly.
When I'm busy doing all kinds of other things, but now's my chance to do that.
Yeah.
Is that it?
That's exactly it.
Okay.
I'll tell you, I've had some folks come in that bought policies last year or the year before, and they renewed them and their premiums went up. So they come to me and they say, Byron, what do I do? And I say, well, you know what? Let's go shop. Let's kick the tires and see what's out there. So we go out there and we look and we find a comparable policy that's less money. And so they're able to enroll in that one. They get some tax credits, some of them don't. But some of them pick these policies, some go with private sector, some go apply for Access. One important thing to mention about Access, it's the state Medicaid program, and it's 365, 24/7. No open enrollment closed dates. You can do that anytime during the year. The big push for folks is to help avoid that penalty, and that's when those enrollment dates become effective.
All right, let's take our first break. They've actually got a couple of events coming up. I shouldn't say events, but kind of a conference where you could sit down and hear more of this. But Byron Lewis of North Country Healthcare in studio today. Phone number is 928-522-9580, 522-9580. This is Countywide. We'll be back in just a couple minutes.
You're doing great. We're gonna try this again, okay?
Okay.
Wheels, pedals, handlebar, brakes. Sit up straight, keep your weight in the center, keep your eyes on the road, hands on the grips, button the seat. If we feel ourselves falling, what do?
Just keep
pedaling.
pedaling.
Good girl. Now remember, it's all about balance and steering. Steer with your hands, steer with your body. Steer into the corners and you stay out of trouble. And the bell's your buddy, so go ahead and ding that. All right, you ready? Here we go. Pedal, honey, pedal. There you go, you're a bike rider.
Most parenting is hard to do in just 2 minutes. But 2 minutes twice a day making sure they brush is easier, and it could help save them from a lifetime of tooth pain.
This new mom is struggling to get the skates just right. And now she's holding on for dear life. Her kids can see she may have broke her knees. They still love her though she looks like she's attacked by killer bees. I'm allergic. Prove you don't have to be perfect to be the perfect parent.
Thousands of siblings in foster care will take you just as you are.
Looks like it's done.
Don't let salmonella get funky with your chicken. On average, 1 in 6 Americans will get a foodborne illness this year. You can't see these microbes, but they might be there. So learn the right temperature to cook each type of meat. Keep your family safe at foodsafety.gov.
Welcome back to Countywide. Byron Lewis in studio today talking about Affordable Care Act. He's with North Country Healthcare. They have 2 enrollment events coming up this week on November 13th in Prescott Valley at the Community Health Center, Yavapai County Community Health Center, from 2 p.m. to 7 p.m., and then one the day after Saturday in Cottonwood at the Yavapai County Health Department building on 6th Street there from 10 to 2. So those are coming up. So if you don't get questions answered here today, you'll have, you said, navigators?
Yeah, we'll have a couple of navigators there, and if you need them answered in Spanish, we'll have some Spanish speakers there too.
Okay, so that'll be great. Now, back to the penalty stage. You said that I would be asked on my taxes whether or not I have health insurance.
Yeah.
Now, what if I just say, sure, yeah, I got it, but I don't?
They'll do some verification, but if you do manage to get through it and they find out later that you don't, you'll pay the penalty.
Okay, all right. And then why did we go from $95 that first year for a penalty all the way up to over $1,000 or $600 and some odd dollars?
You know, that's a good question, and I think what the push has been is to encourage folks to get health insurance. The carrot is that you'll have coverage, you'll have a better health outcome. The stick is if you don't have it, you're going to be penalized.
So that's been kind of staggered to encourage us to go ahead and sign up.
It has.
All right.
I think that's a fair assessment.
Okay, so open enrollment starts again November 1st?
November 1st through January 31st at midnight.
Now, what if we don't do anything between those dates?
Well, then you're not going to be covered. And
at all?
Well, if you don't have insurance. If you already have insurance or you're renewing an insurance during that open enrollment, you're going to be fine.
Okay.
But if you don't have insurance and you miss those enrollment dates, there are some things that would qualify as a life-changing event. Now, here's one that just cracks me up.
Okay.
I have 4 sisters and 5 sister-in-laws, and if I tell them being pregnant is not a life-changing event, I'm going to get shot.
Oh yeah, definitely.
Yeah. But under the Affordable Care Act, being pregnant is not a life-changing event, but having a child is. So if you have a child,
that is really odd.
I know. So is the e-cigarettes. But having a child outside of the open enrollment period qualifies as a life-changing event. Another one is if you lose your job, or if you move out of your service area. Another one is, in some instances, if you're a victim of domestic violence, either gender, either way. Another one is if you lose your insurance, or if you have a temporary insurance like COBRA, and that runs out, then that qualifies as a life-changing event. If you adopt somebody, if you lose a spouse. There are some others on the other side of that spectrum. If you get more hours or you start making more money, that can affect it as well. So those are some of the things. Now, there are some people that are exempt. They're not going to have to pay a penalty no matter what. Those folks are in jail. If you're in jail, you don't have to pay a penalty and you're exempt.
But you still have health care coverage.
You do there.
Right.
If you're a Native American, you don't have to pay a penalty and you have open enrollment year-round. If you belong to some recognized health ministries, then you don't have to have have coverage. and you have the pass as far as paying a penalty. The Amish come to mind. They have a big group that goes out. They cover the costs for their members at the hospitals. So those are some situations for exemptions. Now there are some that are unusual that are outside of that scope that would be classified as a hardship. And for that, you'd want to visit with someone like myself, a navigator, who will help you understand what those options are and can help you with the paperwork and get through that. Because some of the process, it's pretty easy, but some of it helps to know somebody that's been through the ropes and can help get you through.
It sounds like it could be kind of confusing. So if something happens to me that's life-changing at any time of the year, what does that mean?
That means that you qualify for an open enrollment period in the marketplace, and you could go in and you have a 60-day window in most instances to examine those policies, see if there's one that fits, and pick it up.
So, but okay, let's say I get this huge raise. Same thing applies there.
No.
No?
Let's say on the raise, let me be very clear on this.
Okay.
Let's say you're working and you have a policy that has tax credits, and I'll talk about tax credits in a minute, and you get a big raise. You want to go on to the healthcare.gov site and adjust your account to show that you've made that increase. The reason why is at the end of the year, you don't want to owe Uncle Sam a rebate on what you've been given.
Gotcha.
Tax credits work like this, and you sign up for a policy. Depending on your income and these other circumstances I mentioned earlier, you may qualify for tax credits. Last year in Arizona, 84% of the individuals that signed up for a marketplace qualified for a tax credit. The average tax credit in Arizona was about $154 on their policy. The way that works is it can be applied directly to your premium, where they'll pay it to the insurance company for the policy you pick, or you can opt to have the whole amount refunded you at the end of the year and pay the full premium price up front as you go month to month. Or door number 3 is you can have part of it paid toward the insurance company and part of it held back in kind of a reserve. But at the end of the year, if you find out that your income has gone up and you haven't reported that in, and you go to file your taxes and they adjust your tax refund or your tax return, there's nothing worse at the end of the year than thinking you have something coming in and having to turn around and pay a refund back to Uncle Sam.
Oh yeah, it'd just be devastating.
Yeah, so that's one of the things that helps with a navigator, is we let them know where to go, how to do these things, how to keep checking on themselves so they don't get hit with any surprises.
You've been doing this for how many years now?
This is going on my 3rd year.
And what's been the response that you've seen? I know that first year was really rough, but over time that has gone by, what have you seen when you hold these enrollment events that you've got scheduled, like in this area? What are you kind of hearing from the folks?
You know, that's a really good question, and that's a pretty fair one. And I think having a large territory and having done all these presentations and been in the firing line, I've got some good stories. As I go around and I visit with these people, I have yet to visit with one that didn't want health insurance. They all do. And they all want something that's affordable. One thing that surprised me is, honestly, I thought there were going to be some folks that were going to try and cheat the system. In fact, I thought there were going to be a lot of them. And I've been pleasantly surprised. Americans are good people. Arizonans are great people. There's some that are out there that'll do that. But for the most part, the people that I'm finding are guys that are working hard, and families and moms, single moms, that are working hard, and they just want to find a break. There is nothing worse, I think, than being a single parent, waking up in the morning, wondering when your kid's going out to play football or soccer, or they're going to march in the band, if there's some way that they got hurt, how would you cover that cost? That is a fearful thing. And this provides a way out for some of them. For many of these people, it's the first time they've ever had insurance. The thing that everybody also wants to know is, you know, how much is it going to cost me? Am I going to be penalized? And when do I enroll? And the most important one is, how do I get some help doing this? It's a daunting thing for many folks, trying to figure out what premiums are and deductibles are, and what's a gold, silver, bronze, platinum plan, and what's covered, and is my doctor in this insurance group, and are the prescription drugs I'm taking going to be covered, and what happens if I have to go out of network? I mean, those are questions that impact our lives on a day-to-day basis. And so what we do here is we try to give them some hope and give them some answers. And I still get folks that call me on, you know, where can I go to get this kind of service? And we let them know. I'll tell you one thing that I won't do, and I have never done, is I won't tell you what policy to pick. I get asked all the time, if I was your wife, or if you were my son and I was your parents, what policy would you suggest? And I tell them, I'd pick the policy that's best for you. I would tell you to pick the one that, because you know your family's needs better than anyone else. Mm-hmm. I'll give you your options. Here's door number 1, here's door number 2, here's door number 3. But at the end of the day, you're going to make that decision because you know better than anyone else.
Let's take a break. Okay, we've got 2 enrollment events coming up. One Friday, Community Health Center in Prescott Valley from 2 to 7. One in Cottonwood at the Community Health Center there on 6th Street from 10 to 2. This is Countywide. We'll be back in just a couple minutes.
Cinderella found the pet that fits her perfectly. Tiana gave her pet the royal treatment. Belle found beauty when no one else did. And you can too. Share your heart. Share your love. Bring home your forever friend. Make a shelter pet part of your world. Happily Ever After begins at theshelterpetproject.org.
Right, mi cariño. So like I said, everything I learned about cooking, I learned from Grandma's empanadas. Shall we go again?
Yep.
Mix beef with the onions with the peppers with the paprika with the garlic with the oregano with the cumin. Got it?
Got it.
Throw on the olives, stir, season, stir again, pour out the flour, roll out the dough, make a circle, drop in a fistful of filling, fold over, press down, and ta-da!
Most parenting is hard to do in just 2 minutes. But 2 minutes twice a day making sure they brush is easier, and it could help save them from a lifetime of tooth pain.
Because of Shriners Hospitals for Children, I can play basketball. I could climb stairs. I can write my name.
At Shriners Hospitals for Children, love is caring for a child, regardless of the family's ability to pay. If you know a child we can help, visit shrinershospitalsforchildren.org.
Of all the things you've done with your bike, donating it to Goodwill may be the most incredible of all. Your donations help fund job placement and training for people in your community, which means your stuff can be more powerful than you think. Goodwill. Donate stuff, create jobs.
Welcome back to Countywide. Just about a minute left of the program. Byron Lewis with North Country Healthcare in studio. They have 2 enrollment events coming up. You can talk to a navigator about the Affordable Care Act. I would definitely need 1 or 2 of you guys to help me through this. But they have 1 event coming up on Friday, the 13th of November in Prescott Valley at the Community Health Center from 2 to 7. And then there's one on Saturday, the 14th in Cottonwood at the Community Health Center from 10 a.m. to 2. Anything else we definitely need to know before you walk out the door today?
Just a couple of things. You may be closer to insurance than ever before in your life. And the statistics are pretty accurate. Folks that have health insurance traditionally have healthier outcomes. Whether you're for the Affordable Care Act or not, it might be in your best interest to go online, kick the tires, come to the enrollment event, call a navigator, give me a call, and just see what your options are.
Let's see if it works. Okay. And the phone number, 928-522-9580. 522-9580. Byron, safe travels today. We've got snow in the forecast and all kinds of stuff, and you're going to be driving all over it today.
Sounds like it'll be a good day.
Yeah, drive with care and give yourself plenty of time to reach your destination.
Hey, and thank you folks for having me on.
I appreciate you coming in. All right, that's today's Countywide. Thank you so much for watching and listening, and we will talk to you again next time.
This has been Countywide. Listen in each Tuesday and Thursday as we tackle the hot topics and talk to the decision makers across Yavapai County. That's Countywide with Kyle Benedict and Paul David. Each Tuesday and Thursday on this Yavapai Broadcasting station.